Hello everyone. So I've had a few requests to actually present these online. They're my presentations that I've been doing within the office, but I think what I'm going to start doing is doing, the in-person presentations and then followed by just doing a voiceover of the PowerPoint presentations that I create for those of you who are unable to make it to the actual office or who live too far away. So I'm Dr. Claire, and I am the second chiropractor at Center for Life Chiropractic, if you don't know who I am. And then this presentation is called Eating for Bone Health. It summarizes the 5 essential nutrients that are needed for the skeletal system and healthy skeletal support. So I wanted to start out and just talk about what bone is exactly. It's composed of 2 different items, so collagen and calcium. Bone provides support for the body, so without it we wouldn't be able to move or mobilize ourselves. And then it does contain about 99% of the body's total calcium. So why should you care about intaking nutrients to help your bones? Well, bone is constantly resorbed and remodeled, so it's not like we're born, our bones grow to adult size, and then that's it. They're constantly being absorbed and remodeled, like I said. So it's something that we have to consistently provide nutrients for that process so it can continue at a healthy rate. So a few other pointers to keep in mind is that after age 20, bone loss is greater than bone gain, which means that as we age, obviously, but starting at age 20, we need to really start focusing on the nutrients to support the skeletal system, and then as well as post-menopausal women with their decrease in estrogen, that highly affects the skeletal system in women after menopause, because estrogen is a hormone that is involved premenopausally with bone formation, repair, as well as growth. But by 65, both men and women, which is an important note to make here, both men and women lose bone density at approximately the same rate. So by 65, men and women really need to focus on taking in nutrients to help support their skeletal systems. So why should you care what you put into your body? This is something that needs to be honed in at a young age, because we really are what we eat. So if we eat a bunch of garbage, you're going to feel like garbage. You might not look like it on the outside right away, but on the inside, every time you eat something, your body is going through different chemical changes, and it's microscopically and you can't see, obviously, but food really has a huge impact on how we think, how we feel, how we act, and what we can do and what it allows us to do in our lives on a daily basis. That's why food is so important, and food choices too. So a big point that I wanted to make in this presentation is that calcium is not everything. With the dairy industry pushing calcium and all the advertising that's been going on the last 20 plus years with milk does a body good, it's not really everything in terms of skeletal and bone health. So you also have to consider these other 4 vitamins as well that are involved in the skeletal system and the health of the skeletal system. And that is vitamin D3, magnesium, vitamin K2, vitamin C, and then also calcium. And I want to go back to vitamin K2, and this is completely different from vitamin K1. Vitamin K1 is involved in blood clotting, and then vitamin K2 is involved in the absorption and distribution of calcium and vitamin D within the body. So another big point, which is going back to how calcium isn't everything, is that osteoporosis is scurvy of the bones. And most of us know that scurvy is actually a deficiency in vitamin C. So osteoporosis is scurvy of the bones, which means that osteoporosis is a deficiency in vitamin C and not calcium. And here's just another slide proving or just reinstating that osteoporosis is scurvy of the bone, not calcium deficiency. It's a vitamin C deficiency. And I think we've kind of been told for so long that calcium is everything, and osteoporosis and osteopenia, let's throw more calcium at it and it'll help. No, not true. yes, you do need calcium, but you also need those other 4 vitamins as well in the previous slide. So this is just a good slide to show that our bones need more attention as we age. As we age, cellular metabolism slows down, things in the body slow down, and we don't repair as fast as, as we did in our youth. So you just need to really be mindful of supporting your body and helping your body with the normal processes so that it can function at normal capacity. So a couple points, and this is actually a pretty important point. In understanding vitamins, so you have your fat-soluble and your water-soluble vitamins. And I'm only going to talk about the ones that are involved in this presentation today. So the fat-solubles that I'm presenting are vitamin D and K2, and this means that these need to be taken with a meal that has some kind of fat in it so that your body can absorb it properly. If you take vitamin D or K2 on an empty stomach, you're not going to absorb it. So there really is no point in taking it. You're just throwing away your money. And then you have the water-solubles, vitamin C, magnesium, and calcium. Now these are fine to take with just a glass of water. You don't have to worry about them not getting absorbed, but they do need that water to attach to so that your body can absorb it. And then here is just a breakdown of all the vitamins that are important, all 5 of them important in today's presentation, as well as the recommended daily requirements. So one that I wanted to point out is vitamin C, and I said that you can do it up to 3 times daily, and what I mean by that is vitamin C only gets absorbed 500 milligrams at a time that you take it. So if you want to intake about 1,500 milligrams a day, I suggest not taking it all at once. You want to split that up, so maybe do it with breakfast, lunch, and dinner so that you can absorb it, because your body, again, only absorbs 500 milligrams of C at a time. So I want to talk about vitamin D first, because that's a really important essential vitamin that we all need to be taking regardless of your health and what state you're currently in. Every cell in the body requires it, so it is a pretty in-demand vitamin. It helps boost immunity. It helps with the brain and nervous system, the health of the brain and nervous system, I should say. Helps maintain proper mood, and obviously bone and teeth, which is why it's in this presentation. It helps to regulate the insulin levels. So anyone who is diabetic or pre-diabetic, or maybe has diabetes in the family and they're worried about, they're taking care of themselves to try to avoid getting diabetes, vitamin D would be a great vitamin to go on. It also helps with lung and cardiovascular health, and as well as turning off cancer genes. So these are just some issues that arise from a deficiency in vitamin D. I'm not going to go through all of these. You can pause this here and read them, but as you can see, it's a pretty essential vitamin, and it does have a lot of impact when there is a deficiency in the body. So another important point to make about vitamin D is that vitamin D is pretty seasonal in terms of obtaining it directly from the sun and naturally. So in the summer months, when we're out in the sun, being active, getting about 15 to 20 minutes is totally fine. We're getting enough, as long as we're exposing, the skin on our arms and probably legs, I would say, so that our bodies can convert those rays from the sun and make vitamin D through the skin. But in the winter, when it's really cloudy, there's overcast, we're not getting that direct sunlight that we need from those important rays. So it's really good to supplement so we can maintain adequate levels of vitamin D throughout the entire year. Also, I wanted to make slides for each vitamin, just listing out foods that people can obtain those nutrients from. Some people don't like taking supplements, so I wanted to include just some food sources that people can go to obtain the adequate levels of these necessary nutrients. So on to magnesium, the master mineral, and in good reason, because magnesium is involved in 300 functions in your body, so it's pretty essential. Magnesium helps with blood sugar balance, circulation and blood pressure, cellular energy, helps with the nervous system and the nervous system health, And as we know, that chiropractic is about making sure that the nervous system is open and clear so that the brain and spinal cord can communicate through all the nerves that exit the spinal cord with the rest of the body so the body can function at normal capacity. So adding in magnesium on top of chiropractic care is pretty good. Magnesium is known as nature's best muscle relaxer, so it helps with pain relief and relaxing muscles. Also with bone density and calcium balance, joint and ligament flexibility, and then it also helps with sleep. It's the relaxing part of magnesium that really helps the body just obviously relax, but then it helps people sleep at night. I have a lot of patients who will ask me what I would recommend as a natural supplement or a natural remedy to help them fall asleep at night, or even just to stay asleep and not be woken up multiple times throughout the night. And a good one is that I always recommend is trying out to begin with is magnesium, because it's natural. The toxicity level is low. It's not a dangerous supplement, and it also just helps relax everything. And I usually recommend taking it about 30 to 60 minutes before bed so that you can allow it to work itself into the system, and you'll notice that it really just helps to calm you down. Here's some plant source bases of magnesium. I'm not going to read all these. You can pause it here or go back. And the next vitamin, K2, which I had mentioned before. A lot of us are deficient on K2 because it's not very common in the American diet, but K2 is important for calcium absorption and distribution, as well as vitamin D absorption and distribution within the body. If we're low on K2, the body will start taking calcium and depositing it into joints and arteries where it doesn't belong, and then it won't allow your body to process vitamin D at the capacity that it should be. So it is really an important vitamin that we need to start really adding into our diets, just not only for the skeletal system and the health of the skeletal system, but also the cardiovascular system. So here are just some food sources that are rich in vitamin K2. Some of them are not very appetizing as others, but you also have the issue of food sensitivities on the rise now with a lot of patients. So this is definitely a good one to supplement with if there are food sensitivities involved or any kind of food allergies. And this is personally a supplement that I take. It's the MK7 version of vitamin K2 by Now. And I recommend the MK7 version because that is the more natural form, and it stays in the body longer so the body can resorb it and recycle it. Whereas there is another form called MK4. It is cheaper, but it doesn't last as long in the body, so you're not going to get the most benefit as well as the most bang for your buck, I should say. So on to vitamin C, and like I mentioned before, vitamin C deficiency leads to osteoporosis. Osteoporosis is scurvy of the bones. So as you can see in these pictures here, especially the top one on the left, that is what normal bone looks like. Bone is naturally porous like that. It's not solid, but when you get into osteoporosis or even pre-osteoporotic bone, you start noticing the walls start thinning and the holes start to get bigger, and you lose structural integrity of the walls within the bone. So that's where you come up with the issue of fractures, injuries. People who are osteoporotic have a more likely chance of fracture, bone breaking, just with simple falls or just any like simple kind of injury that a normal person could recover more quickly from. So vitamin C is definitely a vitamin that needs to be given more credit with bone health. And on top of skeletal health, it's also great for the immune system, as most of us know. It's also a free radical scavenger, meaning that it seeks out bad cells within the body and destroys them. Helps with growth and repair of all tissues, so not just bone, but also hair, skin, nails, anything that contains collagen. It also aids with the absorption of iron, so anyone who might be anemic with low iron counts can supplement with vitamin C to help with that. It helps speed up wound healing, and then, like I mentioned before, helps with cartilage, bone, and teeth. Here's a good picture of some natural sources of vitamin C if you don't want to supplement, and then as well as the quantities and amounts that you can find in each food. So on to calcium, and I want to reiterate that calcium, yes, you still need it, but it's not everything. I'm not saying don't take any calcium. And here's just a nice picture of benefits from calcium other than preventing osteoporosis and strengthening bones. So you can kind of read through these. Some foods that contain calcium as well. You can pause this here and write some of these down, throw them on your grocery list. I'm not going to go through all of these. And then I want to make a point that health is a lifestyle. In addition to eating healthy, you also have to exercise. You have to be mindful of what you're exposing yourself to. I know we don't have a choice, most days because pollution is in the air, products that we use, but we can do our own research and we can make a difference. I mean, we're responsible for our own health. You can't always rely on practitioners and give them 100% responsibility for your health. You really need to take time to do some solid research, find out what's good for you. Yes, you can use us as sources, and we're good resources for this, but your health is your responsibility. You can't blame anybody else for that. In addition to eating healthy, though, you want to make sure that you're doing some weight-bearing exercise. So any kind of resistance is good because as you use weights to exercise, your bones respond to that by laying down more bone to compensate for that additional force. Also, no smoking or excessive alcohol intake. Both of those prevent and decrease the rate of bone repair, bone resorption. So neither of those are good. As well as you want to make sure that you're doing bone density testing. If you're already diagnosed with osteoporosis or osteopenia, you most likely already have done this with your doctor. But if there is a family history and you're genetically predisposed to this or have a risk of it, it's always good to have bone density testing performed so that you can have a baseline to start off with, and then just monitor your growth as you progress. And then medication when appropriate. Not all prescriptions are bad. So just to recap the presentation, so the 5 essential nutrients for bone health are calcium, magnesium, vitamin K2, and vitamins D and C. So I wanted to thank you guys for listening to me throughout this whole presentation. I'm sure it was difficult. If you want to go back and look at some slides, you can just mute me. But I look forward to doing more of these in the future, especially for those of you who are unable to make it to the weekly or the presentations that I do during the week at the office. So I definitely appreciate your time, and I hope you've learned something today. And if you have any questions, you can always just comment below, or you can always private message me too on Facebook. I'm okay with that. That's totally fine. All right, guys. Well, have a great night, and I will see you all soon.